Today, nearly 100 Columbus police officers are getting some extra training.
Just a few hours ago, officers went through a full day of advanced crisis intervention training. It's to help officers with calls dealing with behavioral health crisis. 10 TV's Ava Hedges was there for the training. She joins us live in Franklinton. So Ava, tell us more about how officers are now going to use this training for future calls.
Jeff, Stacia, I asked officers and officials how they shape their curriculum, but also how the community can weigh in on how our police respond to crises. Officials today tell me that they bring people in crisis here to the Franklin County Crisis Care Center.
Because everyone deserves the best care possible. I mean, plain and simple as that.
Carly Tennant is the Director of Clinical Services at Franklin County Alcohol, Drug, and Mental Health Board. Officials with CPD say that last year they received over 23,000 mental health calls for service.
We have to get you to the hospital.
Carly says that due to a decrease in mental health stigma, there's been an increase in calls for help. And as a result, that's driving the demand for trained officers responding to mental health situations.
That's when people are going to feel heard. That's when people are going to get better. That's when recovery works.
And when that happens, Carly says,
everybody wins, right? The person in crisis wins, their family wins, their community wins, the law enforcement officer wins.
I asked how the program will continue to achieve that success. Lieutenant Mike Voorhees with Columbus Police says officers' experiences help shape their curriculum.
If we do order a commitment,
but we're finding out what do we need to put more emphasis on? Where are we learning? What are we not learning? What are the key areas that we need to key in on?
I asked if the community gets to weigh in too. Lieutenant Voorhees says a quarterly meeting is where members of the community voice their feedback.
What would you like to see from CIT? What do you think CIT training should be? Who do you think we should invite? Do we have the right people at the table? Do we need more people? Do we have less people? And what's the community's feedback? What would they like to see officers doing on a mental health call for service?
What do you want them to be assured of when the police show up?
Sure, if we're going to be there, we're helping. We're here to help the community. We're here to do what we can. We recognize there's a lot of people who need help, mental health help.
Lieutenant Voorhees tells me that the goal is to have 100% of the police force CIT trained. Reporting live in Franklinton, Ava Hedges, 10 TV News.